Good morning, wherever you are. This is Vesper Quill from ConferenceHype. Our segment will focus on a computer vision algorithm to predict superior mesenteric artery margin status for patients with pancreatic ductal adenocarcinoma. From the 2026 May 1 edition of Annals of Surgery. Background, complete surgical resection, is the only chance to achieve a cure for PDAC. However, current modalities to predict vascular invasion have limited accuracy. Methods: adult patients with PDAC who underwent Whipple and had preoperative contrast-enhanced CT scans were included. Results: 200 patients were included. Discussion: we demonstrated the feasibility of developing a computer vision algorithm to predict SMA margin status using preoperative CT scans, highlighting its potential to augment the prediction of vascular involvement. From the 2026 June 1 edition of Annals of Surgery. Background: the revised IAP guidelines for surgical indications for branch duct intraductal papillary mucinous neoplasms include the presence of at least 2 worrisome features without mandatory endoscopic ultrasound. Methods: among 663 patients who underwent resection for pathologically confirmed IPMN in a tertiary hospital between 2013 and 2023, 556 patients with BD or mixed-type IPMN were retrospectively reviewed. Results: a total of 540, 451, and 490 patients met the surgical indications of the IAP, 2017, 2023, and European guidelines, respectively. Discussion: the IAP 2023 guidelines showed better malignancy prediction than the IAP 2017 and European guidelines, potentially reducing unnecessary surgeries. From the 2026 May 1 edition of Annals of Surgery. Background: despite their use in surgical research, the Elixhauser and Charlson comorbidity indices were developed nearly 4 decades ago utilizing primarily non-surgical cohorts. Methods: adults undergoing 62 operations across 14 specialties were queried from the 2019 National Inpatient Sample, using the International Classification of Diseases, 10th revision codes. Results: a total of 699,155 records from the 2019 NIS were used for model development. Discussion: the core score may better predict in-hospital mortality after surgery due to comorbid diseases in outcome-based research. From the 2026 May 1 edition of Annals of Surgery. Background, complete response. POPF is a major source of morbidity and mortality after PD. Methods: between 2015 and 2020, patients who underwent PD at 2 high-volume pancreas centers and had intraoperative drain placement with measurement of DFA1 and DFA3 were retrospectively reviewed. Results: 923 patients were included in the analysis. Discussion: the risk of complete response. POPF after PD can be accurately estimated based on the measurement of DFA1 and DFA3.
This is ConferenceHype. Stay with us, coverage continues.
From the 2026 June 1 edition of Annals of Surgery. Background: pancreatic ductal adenocarcinoma usually recurs following potentially curative resection. Methods: PDOs were established from pretreatment biopsies in a multi-institution clinical trial and clinical specimens at a high-volume pancreatectomy center. Results: our function matched 91% of PDOs to a standard of care regimen. Discussion: In vitro PDO pharmacotyping can inform pancreatic ductal adenocarcinoma therapy selection. From the 2026 Jun 1 edition of Annals of Surgery. Background: little is known about the prognostic significance of pancreatic duct dilation following pancreatiduodenectomy for intraductal papillary mucinous neoplasms. Methods: all patients who underwent pancreatiduodenectomy for non-invasive IPMN at 9 pancreatic academic centers between 2013 and 2018 were included. Results: 481 patients were included in this study. Discussion: new main duct dilation in the pancreatic remnant after pancreatiduodenectomy for IPMN is common, occurring in 27% of the patients. From the 2026 May 1 edition of Annals of Surgery. Background: a higher percentage of patients with CDH are surviving to discharge, accompanied by an increase in morbidity requiring surgical interventions, such as tracheostomy and gastrostomy tube insertion. Methods: neonates who underwent CDH repair between 2012 and 2022 in the United States Pediatric Health Information System database were identified. Results: a total of 4,003 patients underwent CDH repair and were discharged from their index hospitalization. Discussion: surgical morbidity exists in patients with CDH after initial CDH repair. From the 2026 Jun 1 edition of Annals of Surgery. Background: the ideal oncologic surgical outcome is a negative transection margin with normal pancreatic epithelium left behind. Methods: consecutive patients with resected and histologically confirmed IPMN-derived PDAC from 6 international high-volume centers were included. Results: overall, 832 patients with IPMN-derived PDAC were included, with 322 patients having an R1 resection on final pathology. Discussion: in IPMN-derived PDAC, normal epithelium or low-grade dysplasia at the neck have similar outcomes, while pancreatic neck margins with high-grade dysplasia or invasive cancer are associated with poorer outcomes. This is ConferenceHype. Stay with us, coverage continues. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 July 22 edition of Annals of Surgery. Background: to determine whether normothermic machine perfusion mitigates the historical survival disadvantage of donation after circulatory death liver transplantation compared with donation after brain death livers. Methods: we performed a retrospective cohort study of adult LT at a high-volume U.S. center between 2019 and 2024. Results: among 1,338 liver transplants, DCD-NMP grafts had a significantly higher donor risk profile, yet demonstrated survival comparable to DBD transplantation. Discussion: NMP enables safe utilization of DCD liver allografts and achieves graft and patient survival comparable to DBD LT, mitigating the historical disadvantage of DCD grafts. From the 2026 May 1 edition of Annals of Surgery. Background: surgical and endoscopic transgastric approaches are used to manage retrogastric pancreatic necrosis. Methods: LTN-treated or DIN-treated patients at Stanford University Hospital between 2011 and 2023 were identified. Results: 106 patients were identified. Discussion: LTN is a safe and efficient treatment modality for walled-off necrosis, and compared with DEN, can reduce the LOS in high Apache 2 score patients. From the 2026 May 1 edition of Annals of Surgery. Background: symmetry of lymphatic anatomy has been assumed historically. Methods: 36 normal female volunteers underwent bilateral indocyanine green lymphography and lymphoscintigraphy of the upper extremities. Results: among the 36 participants, 10 showed symmetry of all 8 upper extremity lymphatic pathways with ICG. Discussion: lymphatic anatomy and functional drainage of the upper extremities are not consistently symmetric. From the 2026 May 1 edition of Annals of Surgery. Background: AAC is widely seen as the best indication for MIPD due to the lack of vascular involvement and dilated bile and pancreatic duct. Methods: this is an international cohort study encompassing 27 centers from 12 countries. Results: overall, 1187 patients after MIPD for AAC were included, of whom 572 with AACAT and 615 with AACPB. Discussion: this international multicenter study found no differences in outcomes between MIPD and OPD for AACAT and AACPB.
This is ConferenceHype. Stay with us, coverage continues.
it for now for ConferenceHype's coverage of the May 2026 issue of Annals of Surgery. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.